So today we're talking to Vicky McGrath, who is the CEO of Rare Diseases Ireland. You're very welcome to the show.
Thank you very much, John.
So you might start, if you will, by telling us what is a rare disease? What defines a rare disease?
Certainly, I will. So a rare disease is defined at a European level as a disease that affects less than 1 in 2,000 people across Europe. There are estimated to be about 6,000 to 8,000 different rare diseases. And I guess every day as science and innovation moves forward, we learn about more rare diseases. Typically, they're genetic in origin. About 70% of rare diseases are genetic in origin, but they all can also be caused by rare viruses, something that might be unusual in Europe, or environmental exposures or things like that as well. So I guess, rare is rare only in name. Individually rare, collectively common is the kind of phrase that we typically use, because actually in Ireland there's about 300,000 people living with rare diseases.
Wow, that's a huge amount. And I presume the likes of genetic research and that type of thing are very important.
But they help greatly. One of the biggest challenges, I guess, facing people living with rare diseases is actually the diagnosis. You might have a series of common symptoms, and you're told, oh, you have one thing or another, but actually it's getting that root cause diagnosis as to what exactly is causing those symptoms. And quite often people are getting that diagnosis through genetics and genetic testing. But for many, I guess, constellation of symptoms, we still don't know what are the genes or what is the genetic anomaly that might be causing those symptoms. And so research is continuing on a daily basis to try and understand how variations in genes from person to person can give rise to these symptoms and give rise to various diseases.
I suppose by their very nature, they must be pretty difficult to diagnose, are they?
Yeah, they are, unfortunately. I mean, we're getting better at it, but Ireland, sadly, about 37%. We did some research last year, published some research last year, and about 37% of people in Ireland are waiting 5+ years to get a diagnosis.
Wow.
So clearly, we still have a long way to go. Now, part of that is our long waiting lists and things like that. But part of it is also just the science isn't there. So you might well go through genetic testing and, have everything looked at, and it's like, well, it's none of the things that we know about today, but maybe you'd get a phone call in a year or 2 years' time. It's like, eureka, somebody has discovered this. They've just published this piece of information, and we think that this might be what's causing your symptoms.
I get you. I did a bit of research during the week, just really into the likes of missing chromosomes.
Yeah.
And there's a lot of rare diseases that come from missing chromosomes.
Yeah, absolutely. So I guess they're a subset of the 70%, but there are still thousands of I guess variations that might happen that can cause or that will result in a missing chromosomes, and that can cause then symptoms. And typically, you're looking at something like intellectual disability in that type of area. But it's not limited to intellectual disability. There may be heart problems or gut problems. I guess one of the big challenges that we have with rare diseases is that they're complex, I guess. And it's not a word that we use lightly, and it's not a word that we like to use, because typically people run from complex, particularly our policymakers. As complex equals difficult. But actually complex is just the lived experience. That's, we're all complex beings, let's be honest about it. And in rare diseases, typically you won't have just one challenge that you face because of your chromosome anomaly. It could affect multiple different parts of your body, multiple different areas of your health, of your well-being, of your I guess your physical abilities, your mental abilities, and things like that. So it's not just I guess, well, there's a chromosome missing here, and therefore this is what it is. There's a chromosome missing here, and you have this range of things. And even when people are living with the same chromosome deficiency, it doesn't mean that everybody has the same symptoms. It can still manifest differently in different people. There's a small bit of, I guess, of our genetic makeup that makes us all different. And if something is different from one person to the next, then that can have an influence on the symptoms that people are living with.
And tell us a bit about, we're going to call it RDI just for our listeners. It's Rare Disease Ireland. So tell us a bit about RDI, when it was set up and what was the purpose.
Yeah, so RDI was actually established back in the late 80s, in the previous century, and the idea behind it was to bring together the separate rare disease patient organisations under an umbrella that would, I guess, advocate for things that are desired across all rare diseases. So individual rare diseases or rare disease patient organisations might be doing research looking for a cure for one condition and won't be looking at other things. But when we're talking about, I guess, policy and healthcare services and the system generally, they're all looking for kind of the same types of things. And so it's to try and, I guess, have an umbrella voice that will bring all of the 300,000 together under one umbrella and say, this is what we need. So when Rare Diseases Ireland was originally established, it was around actually establishing genetic testing in the country, establishing a clinical genetic service in the country. And that was, I guess, established in Crumlin, in the Children's Hospital in Crumlin. And that has evolved now over the last 30 plus years. And we've had a new strategy that was launched at the end of last year. Science and medicine have all moved on, and should you have a genetic service based out of a children's hospital, it's actually half of its patients are adults. And so it's all, I guess, evolving and moving, and unfortunately I would even say that the service that we have in Crumlin has been allowed to or hasn't been invested in, I guess is the best way to put it, and as a result we need to rescale and retool and up our game in genetics, generally speaking. And genetics, I guess, is where the future of medicine is going. We've heard terms like personalized medicine, and that's all around what is your genetic makeup, and will some drugs work for you and other drugs not work for you? What are the best ones for you? And if science and technology are moving in that direction, we would see rare diseases as being at the forefront of that, as being an area where if we understand, if we can take a look at somebody's genetic profile and genetic makeup, we can then determine what exactly is wrong, or what exactly is causing your symptoms, and what are the best therapies that are for you. So it's the united voice of the 300,000. The other thing that I would say is, it was established originally as an umbrella for patient organizations, but with so many different rare diseases and maybe only a handful of people, if even a handful, living in the country with a particular rare disease, you're not going to have patient organizations that are representing all of the different rare diseases. So we're also, I guess, an organization that would like to hear from people that maybe don't have a home to go to, and we would try and provide them with that home, or at least understand what is it that you're looking for representing your disease. And, is there stuff that we should be including in our advocacy work around policy and, when we're targeting leadership at the HSE and things like that.
And when you say a home to go to, you mean an organisation to support you in your disease? We actually, I shouldn't say no, we don't provide individual support. It's just me in the organisation. So I'm trying to gather all of the voices of the 300,000 and formulate where should we be looking for policy and in what areas. So we can't provide individual support, but we can, point you in directions that would certainly, for other organisations that might be able to help you or provide you with some information. But for a number of rare diseases, there won't be an organisation in Ireland, and you're looking to get, I guess, that peer support for your particular rare disease, maybe from an international community, and we can maybe try and help you to find that international community. But in terms of, I guess, what we do, it's most of our work is around advocacy at a policy level. So working with the Department of Health or working with HSE leadership to make sure that the systems are in place to address the needs of people living with rare diseases. So we don't provide individual advocacy and we can't provide, I guess, individual support for people to help them to guide them through some of the quagmire. But there are other groups that do that and can provide peer-to-peer support. You know, if you have a group of families that are all have children, for example, living with different rare diseases, they all kind of face the same types of challenges around accessing speech and language or getting that SNA or, you know, those types of things, and they can all help one another. So maybe it's not specific to your individual disease, but it certainly will help you to navigate, I guess, the quagmire that is the services and supports that are available in Ireland.
And how does RDI support organisations that support people with disability, with rare diseases?
Well, our main role is, as I say, around the advocacy, the lobbying at department level. We have a new strategy that will hopefully we are in the process of developing, or beginning the process, I should say, of developing a new strategy for rare diseases. So our role then is to make sure that we're meeting the needs of the different organisations, that if they're looking for particular pieces to go into that strategy, that we bring that into the room and that we make sure that those pieces are included in the development of a new strategy that could be rolled out over the next number of years.
Very good. Are you a funded organisation?
Not by the state, no. We get our funding through, we have what we call a roundtable of companies, and so it's a kind of a club of companies that have an interest in the rare disease space, and we meet with them twice a year to identify, I guess, areas that they might not have insight into. So, for example, we've met with them and we've talked about what the Rare Diseases Office, the HSE's Rare Diseases Office, what their mandate is, what type of work that they do. Or, for example, around genetics, you know, what's the strategy looking like? Where can industry plug in? There's a new legislation coming through at a European level around development of pharmaceutical drug development, and so we'll meet with them actually at the end of next week around, right, what kind of areas from a patient perspective need more work within this legislation, and how can we work together to make sure that we're all lifting all of the boats. So that is our primary source of income. We will get income then, I guess, for specific projects. We ran a campaign earlier on this year called Get Rare Aware, targeting the politicians and the MEPs, just to try and, I guess, raise the profile for rare diseases generally, and in particular we were again back on the genetics bandwagon. It sounds like where everything's about genetics. It's not, but it is a good portion of the work we've done over the last year and a half, and so you know, we would be funded, industry would provide us with a piece of funding to actually run that type of campaign. So most of our funding comes through industry. We're beginning to get some funding from kind of like HRB through research grants and stuff like that as well. But no, we do not get any funding from the state. I'd love it, but we don't get it.
Wouldn't we all?
Yes.
So tell us, if you will, about the National Rare Diseases Office. What do they do?
So the National Rare Disease...
I should say, what do they do that's different to what you do?
Well, so the National Rare Diseases Office, there was a plan written in and launched back in 2014, and that's the only rare disease plan we've had in the country. And as part of that, a National Rare Diseases Office was established. And the role of the National Rare Diseases Office, I would say their primary role is an information hub for people living with rare diseases, for families, and for clinicians, for you know, people out in the community, for GPs, for you know, consultants and things. And it's I guess they have mapped where the clinical services are, where the expertise might lie in the country. They have also identified, they work very closely with European counterparts to gather all of the relevant information around individual rare diseases, to make that available to clinicians, to people living with the diseases, to families and things like that, as to what's the relevant information, what's good information to have, what maybe are the best clinical guidelines to follow, what's, you know, what does the disease look like, how do you do a diagnosis and things like that. So they're really an information hub. They've also worked, I guess, to
to streamline some of the pathways so that people that as they're on that diagnostic journey that they're getting through to the best consultant, and I shouldn't say best consultant, but the most expert consultant in the country who has the most knowledge and understanding about this disease. They also try to map some of the research that is happening on an Irish and an international stage so that people can maybe get access to research, particularly to things like clinical trials where new drugs are coming. So they're really an information hub, I guess. We are, at the moment, they are positioned within the hospital system, essentially. So physically they're located in the Mater, but they are under the auspices of the HSE's hospital group system, and we're trying to move them out of that and up to kind of a more strategic level so that they would have a better overview of the whole healthcare system, that they would include things like community care and stuff like that, that they would have a better understanding of what's happening in the community area and where does it need to move to address the needs of people living with rare diseases. So they've been very good at, I guess, working out what consultant and what hospital can deliver what type of care and has the team around them to support that type of patient. But obviously we all know people don't live in hospitals, they live in the community, and in, I guess, as we're all heading towards in terms of sláinte care, the right place, right time, people want the care much closer to their home. So you might not get the expertise of a consultant in your community, in the town or village that you live in, but you would like to know that the expertise of a speech and language therapist is available to you locally, or of a physiotherapist or whatever. And sometimes we need to make sure that they also have the skills to deal with somebody with a rare disease. So when you're faced with somebody across, in your waiting room or in your consultation room that says, I've been diagnosed with XYZ, that you don't go, ooh, I don't know what that is, I don't know how to deal with this patient, but that you can actually understand, and that there's a rare diseases office, there's an information centre that I can go to fill in those gaps in my knowledge, and can therefore provide the best care to these people that are living out in their communities, essentially.
Do some diseases pass out of the category of being considered rare if more is discovered about them?
Yes. I think, as you increase awareness, you will increase diagnosis, because more people begin to look for a disease, and therefore it'll fall out of the 1 in 2,000 definition. It'll fall out of that. There are rare diseases in Ireland that are technically rare diseases at a European level, but might not be so rare in Ireland. For example, something like cystic fibrosis is not all that rare in Ireland, but actually across Europe it is, and it is considered to be a rare disease. But things also work in the opposite direction. So, cancer was the big C back in the 90s, and it was just cancer, it was just this umbrella term. And then it became kind of like, well, there's breast cancer and there's prostate cancer and there's different types of cancer. And now we're working down to what genes are being switched on and off, and what type of cancer very, very specifically is this. And more, as you break it down into smaller and smaller groups and have a better understanding, technically you're now heading into, this is a rare thing because actually it only affects 1 in 10,000 people, or it's only a very small grouping of the cancer population that have this particular makeup or profile. So it works, I guess, in both directions, really, is what I could say to that.
And you might tell us about sorry, I'm not going to lose myself. You might tell us how important genetic research is in improving the lot for people with rare diseases. And a bit of a loaded question, are there other areas other than genetic testing that help people?
I guess genetics and genetic testing gives you a better understanding of what are the underlying mechanisms, maybe, but this is into deep bench research, really, it can get down to such a level that you're kind of, I don't really see how that works for me, or how that will change my life. But I guess, since the first
human genome was read, or I'm not sure what word they used. Anyway, I mean that's only 20 years ago, and now we're at a stage where we're getting gene therapies that are, replacing malfunctioning or missing genes in people, and are now potentially curing, we hope long-term curing diseases. So, you've moved from let's treat the symptoms to actually here is a cure now for this disease. So there's a couple of those that are available in Ireland. There's one for a rare vision impairment. There's one for spinal muscular atrophy. And so these are, this is, I guess, why the bench science is so incredibly important, and that deep understanding. But I'd have to say, when you are now in your 20s living with a rare disease and you're thinking, well, really, do I have to wait till I'm 50 for something like that? Can we not do something today to allow me to live a better life? And so a lot of our work and our research is around, I guess, what is the state of play today and where can we move it to in 5 years' time? So, yeah, there's lots of deep science and, very skilled and specialized people trying to understand what's happening in the genes level. There's also a huge need to understand, well, what's happening in the community and how do we improve the lot of people in the community? And one of the things that I would say, I guess, is, like you mentioned earlier on, 22q11 deletion syndrome, and Anne Lawler, who's a member of our board and founded that organization, she is always banging the table about the back of the ranch. The lived experience for people at home is very different to, what a scientist might be looking at in terms of genetics. And so we need to be very cognizant of that and try and raise all of these boats and try and understand, how do we deliver these, say, for example, the community disability network teams, how do we get them up and running and working properly and delivering for people on the ground, and not have these massively long waiting lists and parents trying to get information, trying to get their children seen by a speech and language therapist or a physio or whatever, resource they're looking for. And that, we improve that system as well. And research needs to be done to understand, why is it poor? What can we do? Who needs it? How do we manage that type of stuff? And I guess I would feel that historically, there's been pockets of good work out in the community, but the focus of our healthcare system has been around hospital-based care, and we need to move away from that model and look more at how do we deliver much better care in the community, close to people's homes, that they can actually live their best life, that they can have, that they're not sitting on buses and trains or in cars trying to get to Dublin to a specialist consultant in Dublin. How do we move some of that stuff out of Dublin,
And you lead me right into my next question, which is, tell us a bit about the report on juggling care and daily life, which is a follow-on from what you just said.
Yeah. So that was a report that was commissioned by Eurordis, our sister organization in across Europe. So they would represent the entire rare disease community across Europe. And they looked at those very lived experience kinds of questions. And it's something that we do want to replicate here in Ireland over the next year or so, hopefully. I keep on saying we'll do it, and we still haven't quite gotten there. But it was looking at kind of like, how much time are you spending organizing your care needs? Do you have the ability to cook? Can you get out in the evenings? What type of, stresses are there in your life that are caused by this rare disease that hinder your ability to do what you would really like to be able to do? And so it's very important to understand, I guess, to get a line in the sand. So we have a European line in the sand as to where things are. And I'd have to say that, the experiences of people across Europe aren't hugely different to the experiences that we know are happening, or the anecdotal evidence here in Ireland. There's a huge demand for much more support in the community, for psychological support and psychological care and things like that, for access to appropriate transport mechanisms and all of these things that we're looking for here. We're not hugely different, sadly, to other places. And I'd have to say, even, when we compare ourselves to somewhere like the States, yes, there are pockets in the US or people in the US that have great healthcare and great systems, but there's an awful lot that we have to thank for here that they don't get in the States. So, don't always think that the grass is greener, I guess. But there is certainly more work that we could do here. So that report was just around, I guess, measuring what are those other variables that are in people's lives that maybe the healthcare system, the focus on drugs and on operations and on ICU or accident and emergency that seems to consume most of our healthcare thought process, that there's actually lots of other pieces that if we can alleviate some of these other challenges that people are facing, that we can then, reduce some of the burden that they're living with on a daily basis.
Very good. Look, I'm going to leave it at that. It's actually a very interesting area. I found it very interesting going through your website. So thank you so much for coming on and explaining all that stuff.
Well, thank you very much to both yourself and to Patrick as well. Yeah. I guess, but before I leave, I would say, it is an evolving space. There's a lot going on at the moment. I know I've spoken quite a bit about genetics and genomics. I'm like, they're in the implementation phase. There's activity happening. You can begin to see a light at the end of the tunnel. We'll have something similar around kind of like an overarching rare disease strategy within the next 6 months, I hope, for the country, that'll start to fill some of these gaps and kind of say, right, we really need to move. We need to move the dial in some of these areas. And I would hope that, if we revisit this conversation in a year or 2 years' time, we'll have some tangible evidence to say, yeah, something has changed, something has moved, and we're all moving in the right direction.
Great. Thanks a million for coming on the show.
Thank you, Vicky.
Thank you very much, guys.
And that was Vicky McGrath from the Rare Diseases Ireland.